honestly, even when it's clearly not right, some people that want it to be shorter in such cases.
Hello, I'm Jong-taek Lim, the director of Rise Plastic Surgery, where beauty comes true.
I heard that recently there's been a big increase in the number of people getting nasal reduction surgery.
Yes, we have been seeing a lot more patients looking for nostril reduction surgery these days. I think it's considered a fairly simple surgery, and since it doesn't make it obvious that someone had surgery while still giving a noticeable change to the face, many people are increasingly interested in nostril reduction. In the past, the surgery itself wasn't well known, but as more information about the procedure spreads, it seems that more people are interested in nostril reduction. Alar-based reduction is usually done using an incision method, and once the flesh is cut, it cannot be reattached. It's an irreversible surgery, so if done excessively, it can appear pinched or fail, and if the incision scar is not properly managed, or if the stitching is poorly done, the scar may remain unsightly, leading to a poor outcome. Usually, patients want to reduce their nostril size while narrowing the width. However, I don't recommend this procedure for those who already have very small nostrils or whose LR base width is narrow compared to the nasal tip. If reduced too much, the nose may look pinched and strange. When a nostril reduction goes wrong by being reduced too much, there's actually no way to reverse it. So don't take it lightly thinking it's a simple surgery, and I'd recommend consulting with someone like me who has a lot of experience before deciding on the surgery. If your nostrils are so small that they are almost invisible, in such cases some restoration is possible through skin grafting or tissue grafting from other areas, but the skin color and tone will differ. We recommend this for cases where the nostrils are pathologically small. If scars remain in an undesirable way, depending on the location, there is a possibility of improvement by re-incising and restitching the scarred area. Looking at the mirror, if you press slightly on the lower part of the nostril and find that the overall shape of your nostrils narrows in the direction you desire, I recommend nostril reduction. People who usually consider alar reduction often do so because their nose looks bulbous or blunt overall. However, it's not always the nostrils that are the issue. Sometimes it's because the tip of the nose looks blunt. For those individuals, I recommend considering cartilage tying or elevating the nose tip. Actually, you should think that the influence of breathing is really not significant unless you excessively reduce it. So even if the whole outer nostrils are reduced to some extent, there's no need to worry about the functionality. So first of all, since nostril reduction is a cosmetic surgery, it is most important to know if you want this type of change. It's also important to see if it actually moves in a more beautiful direction when reduced, so I recommend discussing these aspects with an expert and then deciding on the surgery. There's really no right answer to this, but honestly there are rare cases when some people really want to reduce them even more, even if it doesn't seem right to anyone. In those cases, I try to talk them out of it as much as possible, but if they're really determined to make them smaller, I tend to reduce it as much as I can within safe limits.
How many millimeters can it be reduced to?
The number of times doesn't matter. The point is whether there's room to reduce it, and if you undergo surgery repeatedly, you might end up with scars that don't heal well. So I don't recommend reducing it many times if possible. Reducing the width of the nostrils doesn't necessarily make your nose look prettier, just because you make it much narrower. Each person has an ideal proportion. It's vital to consider these proportions and reduce the nostrils in a way that harmonizes best with your overall features. If you're interested in or want nostril reduction, I recommend consulting with an expert before deciding on surgery. If you come to see me, I'll provide you with the best answer. Please like and subscribe. I'm counting on you.
Thank you.